I'm Dr. Cassie from NAVC's Vetfolio and the host of Vet2Vet. It's one of the least fun conditions for pet owners to deal with, diarrhea. And while the causes of diarrhea are many, we're also seeing a growing number of dietary and other treatment options to help lessen the frequency and severity of these episodes in our furry companions. Here to talk about that and some new science in the world of treating acute and chronic diarrhea is Dr. Adam Rudinsky. Dr. Rudinsky is an assistant professor in the Small Animal Internal Medicine Service at The Ohio State University Veterinary Medical Center. He provides the service with a specialized interest, clinical perspective, and clinically applicable research in gastroenterology, pancreatology, and hepatology. I always think that is such an interesting description, which is why I love having these conversations. So, Dr. Rudinsky, thank you so much for joining me.
Well, thank you guys for having me back. You know, I'll never miss a chance to talk about those organs or diarrhea or anything mixed in there.
Perfect. Yeah, I think just talking about diarrhea is just like a daily part of our lives. We don't think of it as abnormal anymore.
Yeah, at least on a good day, right?
Right, exactly. Well, let's start with something I think we see fairly commonly in general practice. And thinking of my dog, I know he can get really anxious when he boards, almost always ends up being treated for some sort of bloody diarrhea, loose stool, whenever he's being boarded. So what do we know about the role of stress and GI disease?
That's a great way to start this discussion because one of the things that I really am concerned about is the focus that we may not be putting on stress in terms of its effects on the gastrointestinal tract. Our research group here at Ohio State is really pushing a whole section of our research portfolio towards stress-mediated gastrointestinal disease because it is so prevalent, right? Like what you set up as a case example, right? The dog going in for boarding and then breaking with diarrhea oftentimes is not infectious. It is merely stress-related. And in vet med, we often even just throw around the term stress colitis, right? Like it's just that common. But it actually is very similar to things like irritable bowel syndrome in people, which is a functional gastrointestinal disorder where stress plays a major role in that. And when you actually break down the enteric nervous system and its function, one of the things that happens is it's going to control a lot of our hormonal influences, water balance, motility. So if we get a little bit of stress and get serotonin out of whack in the gastrointestinal tract, amongst other things, we can see a wide manifestation of clinical signs merely from stress than just showing up through the gut.
See, this is a good place to start. You already have my rapt attention here where I'm like, wait a second, the enteric nervous system and serotonin's playing a role. Like that's just not something I would think about in terms of the GI tract. Although, of course, we're learning more and more that we should be thinking about the nervous system and all these hormonal influences in the GI tract.
Yeah. And like, for example, 90% of the body's serotonin, roughly species to species, actually lives in the enteric nervous system. Right. So you get a little bit of that like out of balance, and it can really manifest as quite a wide range of gastrointestinal signs. And we're talking about stress colitis in an acute setting in the borders or coming in for hospitalization, but you can get everything from constipation to vomiting occurring in these scenarios as well. But the good news is, like you mentioned in your intro, as much as we're learning now about the role of stress and how it can manifest into gastrointestinal disease, we're also looking at the kind of new wave of therapeutics that are out there that are kind of helping us address this as a different problem, right? So for those patients that have behavioral stress-mediated disorders, we can manage those with anxiolytics and other medications, and we can even choose those based on the patient's symptoms to try to help and alleviate and minimize side effects that may be counterintuitive to their management. And then also dietary therapy is still the most profound effector we know in terms of how to moderate and mediate kind of the development of some of these stress-related gastrointestinal symptoms.
I know the anxiolytics make a big difference for my dog in that example. And certainly dietary therapy, we're seeing a lot of development there with different types of diets available to manage these GI symptoms. So what kind of has changed more recently in the way that we're managing acute diarrhea?
Yeah, so colleague here at Ohio State and myself both have Fiber Life posters in our offices because it's really the wave of fiber, right? And we think almost all the pet food companies are really addressing this, right? If you take a lot of the different prescription diets that are out there, we now see really nice fiber blends in them because even though fiber historically based on different feeding institutions like AFCO, was not considered an essential nutrient, it led to a lot of variability in fiber content in the diet. But as we recognize more and more the role of fiber in gastrointestinal health, stability, and potentially even preventing the development of gastrointestinal clinical signs, that has been something that we're seeing a lot more attention by the pet food companies on moderating that fiber content in the diet, so it has a really nice benefit for gastrointestinal health and stability.
So that's really interesting, talking about fiber, because my next question was going to be about the role of probiotics. But now that we're talking about fiber, when I think of fiber, I think of prebiotics and working in the large intestine. What other types of roles is fiber playing?
Yeah, so I like to traditionally think about fiber in terms of its, physiochemical properties would be the general term, right? So we're talking about solubility, we're talking about fermentability, and we're talking about viscosity. And what really makes a nice diet blend of fibers is different types, right? Because soluble fibers are going to have a lot of that prebiotic function, where the gut flora, the bacteria and other microbes in the gastrointestinal tract are actually going to ferment that fiber. We're going to extract a little bit of energy in the gut from it, as well as produce things like short chain fatty acids that mediate a healthy environment or micro ecosystem in the gut. Whereas you also have insoluble fibers. This would be things like cellulose, and that's really going to be your bulk forming fiber. So thinking of it in that context is probably the best approach to say, okay, I actually get, from a diarrhea standpoint, benefits from both soluble fiber in terms of maybe the anti-inflammatory effects of some of the metabolites from its fermentation. And then I also get the kind of bulking stool effects of that insoluble fiber. And when you translate that to prescription diets that are out there from the big pet food companies, they've created really nice fiber blends that are both in their gastrointestinal support diets, but also in other diet types that they have. And if you're kind of an astute observer and you talk to your scientific service veterinarians, they can walk you through the different diets that they have with fiber benefits like that for these patients.
And I love that they're focusing on these fiber blends, because it sounds like, talking to you here, it's so much more than just like feed them some pumpkin and hopefully it'll get better. That it really has to do with the types and the balance between the types of fibers that you're feeding to this pet. That's really going to make the difference in diarrhea.
Exactly. And so when I started out, like before I got really into fiber and before we started doing some fiber research, it was all about, like I would tell someone, oh, just go put a little scoop of pumpkin on the food. Like, I think we've all done it. If you have a DVM and you're of a certain age, you've done that, right? We all have. But the reality is, if you take kind of a mixed solubility fiber like psyllium husk, right? Metamucil, probably the most common exogenously supplemented fiber type from like store-bought brands. If you take that and you look at the dose of psyllium and you just say like 2 tablespoons, you actually have to feed 3 or so cups of canned pumpkin to equal that same amount of fiber in the dose. So practically speaking, we cannot accomplish the same thing. Even though pumpkin has fiber in it, I can't get to the same finish line using pumpkin in that manner.
I'm so glad that you said that, because I recently looked at the fiber content in pumpkin and I was like, I don't actually think there's very much fiber in here.
Yeah, exactly. Especially when you're considering like calorically, right? Like a dog that needs to eat now 3 cups of canned pumpkin a day, you're starting to throw off their diet in other ways.
Yes, yeah. If they didn't feel good before, they're definitely not going to feel good after 3 cups of pumpkin.
Yeah, exactly.
Well, circling back around to those probiotics, what do we know about probiotics and their role in acute diarrhea? I always wonder this, like what the science actually says about probiotics and diarrhea.
Yeah, so probiotics are a challenging concept with diarrhea. Like if you look at most of the literature that's out there, there's not great support for using probiotics after the fact, right? So
Okay.
probiotics are probably best used in a preventative manner, right? And we can do this with fiber-based diets, we can do this with probiotics, but if you have in that initial example of the dog that's going into the boarding facility and breaks with diarrhea, I could start a probiotic a month before, right, to try to get them on board. And there's certain products that have definitely been shown to have more of that benefit, but it does appear to be something that you kind of need to get those benefits rolling with the animal before the insult to their gut happens. And you have less of an effect size or clinical benefit if you're giving it after the fact. Unfortunately, that doesn't always parallel with how we use them, right? Because as veterinarians, we're faced with the owner that's not coming to us 30 days before boarding. We're faced with the animal that's coming out of the boarding facility that still has diarrhea.
It is an interesting conversation, though, because if we do have those proactive pet owners who say, you know, like my dog, every time we board, then he breaks with diarrhea. Then to have that conversation ahead of time and say, hey, go ahead and start probiotics. Is there some evidence to say that we can have a benefit if we do have a proactive pet owner and we want to start them early?
Yeah, so there's evidence for certain probiotics for that purpose. And the kind of management approach that I try as kind of my first line route is I'm putting those animals on a diet with a good fiber blend as their stable, consistent diet, right? Because an ounce of prevention is worth a pound of cure, right? And then in the interim, right before those episodes, I'll add on a probiotic that has that benefit of kind of preventing diarrhea from manifesting, or at least the severity developing quite as, you know, kind of severe as you might have otherwise. And I think that combination together is pretty successful. And then, like you mentioned earlier with your pet, anxiolytics can be really useful, particularly for the animals that have more generalized anxiety. And I use those on a case-by-case basis.
That makes a lot of sense. I think we could really benefit a lot of pets who do get stressed out in boarding and grooming in these types of scenarios.
Yeah. And, you know, proactively talking to our clients about, like, it's always going to be easier for me to try to prevent these things than for me to try to fix them once they're done. So, you know, kind of early on with the animals we know board a lot and whatnot, kind of counseling those clients.
And making it a little bit easier for them to take a trip and feel comfortable boarding their pet, where they're not like, oh, I'm going to put you in here and then you're going to have diarrhea and it's going to be this whole thing. If they can feel a little more comfortable that their pet's going to be comfortable and not having diarrhea, then they can go out of town with a little bit less stress.
Exactly. And everyone needs a vacation. So
yes, everybody needs less stress.
Everyone's
the
happy.
Pets and the owners. One other topic I want to make sure and ask you about is fecal transplants. I feel like this is something we're hearing more and more about. The closest experience I have, I think, with a fecal transplant was before I went to vet school. And it was, I think we would consider it transvenation from a cannulated steer. We took rumen fluid and ended up putting it into a wallaby who tolerated that just very well. So is that the same thing? And two, what do we know about fecal transplants and their role in treating diarrhea?
Well, one, that's a really cool case. I have unfortunately not been lucky enough to work with any wallabies in my time, but so the concept's the exact same. We're taking microbes from one animal and then transplanting them into another. And this is kind of a cool area because vet med's been doing it a long period of time. Like, our large animal counterparts are really at the forefront of this. But now we're seeing fecal transplant come up because, like you mentioned, there's all this new research in parvoviral recovery, in acute diarrhea recovery, in chronic enteropathies. We're seeing results showing fecal transplants being beneficial. We, along with my colleague, Dr. Winston, who's lead on the study, actually are looking at obesity management in fecal transplants. So it's a really cool area right now of different research. What I usually tell people, though, is yes, it's really an intoxicating kind of area because it's kind of the ultimate probiotic, right? You're taking that whole ecosystem and replacing it, which means it might have a lot more power than just like 7 strains in a probiotic or a single strain probiotic. But at the same time, even though we now have commercially available products that you can give orally or through enemas, and things like that. I still think the data is still pretty new with this, and we don't fully have characterized the risks of fecal transplants as well, right? Because you transplant the good, but you also transplant the bad when you're doing that. So right now, it doesn't appear to be a major risk factor in the veterinary literature, but something that we need to be aware of what we're doing as we move into this. But I think for all the listeners, this is going to be something that keeps coming up because it's such a big area of research, and it appears to be having really positive outcomes in a variety of disease states.
Interesting. So maybe something that's not incredibly widely used right at this moment, but something to really keep an eye on the research and pay attention, because we'll probably see more and more up and coming on fecal transplants.
Yeah. And for me, I like to keep that as kind of it's in that arsenal of treatments that are for my refractory cases. So if a chronic diarrhea case comes in, it's not going to be my go-to first line therapy. But yeah, as that animal fails traditional therapies, then that starts to be something that I'm willing to take a little bit more of a risk on a less well-established therapy, or one that might have a little more risk associated with it.
What else are we looking at that's new in the field of nutritional management?
Great. So yeah, I think I'm glad we got fiber out of the way, because the studies we've put out have shown that's a massive effector for acute diarrhea. It has been shown to be super, super useful in those settings, superior to things like metronidazole for non-infectious diarrhea. So that's a good one. If you aren't using fiber diets, I just want to stress it one more time. Use them in the acute setting, use them in the chronic setting, particularly if you have large bowel signs. Probably the other big thing that I am really excited about, because it's another area that we did some work in, which is fat-restricted diets. And so, there's a lot of diets out there that now have that kind of component to them. And for diseases like dyslipidemias, pancreatitis, and most importantly for me, because they can be such a challenge to control, is protein-losing enteropathies. And there's actually some really cool recent studies, because initial papers like mine just showed that fat restriction can be useful in those cases. But Dr. Jablonski just put out a paper maybe a year or two ago, and it looked at kind of animals that were considered non-responder protein-losing enteropathy cases, and simply a switch from a other GI diet type to a low-fat gastrointestinal diet actually resolved their clinical signs and got those animals into remission. So really recognizing that power and really emboldening us as veterinarians to utilize fat-restricted diets in practice has been really cool to see.
That is cool. Okay, can you say that one more time just so I make sure I followed it? What was the difference with the paper that just came out?
So in that paper, what they looked at was dogs that were put on, say, like a hydrolyzed diet or a limited antigen diet, which are great gastrointestinal diets. But in this paper, what they were on was one of those types of diets or other type of gastrointestinal diets, or other diets in general, plus a immunosuppressive management that was different between each animal. And then they looked at switching those animals to low-fat diets. And those prescription low-fat diets allowed those animals to get into remission, which, otherwise, as a veterinarian, we would have been looking at that patient and saying, well, I've got it on a gastrointestinal diet. I've got it on its anti-inflammatory meds. I'm not getting where I need clinically. And what was that missing piece? It was the fat-restricted diet in those cases.
Got it. Okay, that is really interesting. And I love that you bring up hydrolyzed diets, because that was kind of where I was thinking of next is, these hydrolyzed diets, like you said, they're good for so many things, but it can be difficult if we have a pet who needs a hydrolyzed diet and they also have other dietary needs. So, for example, fat restriction. How would we combine fat restriction and hydrolyzed diet?
Yeah, so the good news is, a lot of companies recognize that, right? Like that's a known kind of concept that we need a good base standard gastrointestinal diet that we would use for like inflammatory gastrointestinal disease, like a hydrolyzed or a limited antigen. And now we have some of those options that are also fat restricted, right? So you're getting the best of both worlds in those scenarios. And once again, it comes back to, I think the nice thing about where we are as veterinarians is we have so many options to manage these cases, dietary, medication wise, etc. But sometimes that can also be overwhelming, particularly if you're not like me and you're seeing things other than diarrhea cases in practice. So kind of understanding what diets are out there and knowing how to get them, especially with Chewy and other websites allowing pretty much anyone to get any diet they need, really has opened up a great kind of opportunity for management with those diets.
It has, but you're right. It has also kind of opened up this almost overwhelming task of figuring out the right diet for the patient. And so I love that earlier you brought up our technical services veterinarians and our scientific services veterinarians, because they can really be a huge resource in walking through what diets are available and how to use them correctly. It always amazes me. I've said this before, where I'm racking my brain trying to figure out what the right nutrient profile is for this patient, and I pick up the phone, and 10 minutes later, I know exactly what to feed, exactly how much to feed, what to look for, how to monitor, and all of this. And I'm going, why didn't I just pick up the phone an hour ago?
Exactly. Well, and it's so nice, right? Because not only, and it's almost a necessity, because you can't just be a one company person anymore, right? You can't only use those diets. So to have your contact at Blue Buffalo, Royal Canin, Purina Hills, etc., and be able to contact them, look at the diet options you have, and then they can guide you to say, okay, you need a hydrolyzed diet. Well, if we look at our HF portfolio, the canned version's also fat restricted, and here's an option from my company that might work for your patient. It just gets you so much more impact from the dietary choices you have for your patients.
And a lot more buy-in from owners too, because when it was like, you're this specific type of, you're to sell this specific type of food, you might have an owner who says, well, that's not really what I want to do. I want to do something else. And now you're, going down a whole nother route and getting them this food. But like you said, with some of the online options and things like that, owners have so many options. So they may say, well, I want to feed, this grouping of food, and having those resources to be able to fulfill what they're wanting to feed their pet, and then also make sure their pet's on the right diet is huge and so helpful.
For sure. I could not agree with a statement more than that, because, I always joke that sometimes it's easier to tell an owner that their animal has a terminal disease than they have to switch the diet, because it can be so emotional for some owners. So if you have companies that relate to them, right, that is such a huge piece. And if I try to sell company A when the owner wants company B, that diet trial is never going to be useful, right? So I need to have that ability to have multiple options and talk to owners about that stuff.
Absolutely. And I think, to a degree, it's understandable. You want the owner to feel good and feel comfortable with what they're feeding. And so I love being able to give them all those options.
Exactly.
Any other new and exciting information on the horizon with diarrhea management, acute and chronic?
Well, one other thing that I think has been really cool to see kind of get recognized a little bit more, because we talked about some diet stuff. We talked about irritable bowel. Those are all loves of my life and from my academic standpoint. But the other thing that I think is really cool is actually bile acid diarrhea. And this isn't something we've looked at a lot from a research standpoint here, but Dr. Torreson and a couple other researchers have really gotten into this. And it's something that's been well recognized in people, but it's the role of bile acid dysmetabolism and how it can actually affect the gastrointestinal tract homeostasis once again and cause diarrhea. But it's not something we think about on a regular basis. But in people, for example, a large portion of people with chronic gastrointestinal disease actually have a component of bile acid diarrhea as well.
Oh my goodness. I have so many questions. I have to hold myself back from going down the rabbit hole. Okay, bile acid diarrhea. So essentially, the gallbladder is secreting bile inappropriately. Is that what we're talking about here?
So that is one mechanism that you can see, or overproduction of bile acids, that's never been documented in veterinary species. So what we typically are thinking about is more along the lines of those bile acids once they're in the gut, right? Remember, primary bile acids are going to be secreted from the biliary system into the gastrointestinal tract, and then microbes convert a portion of those to secondary bile acids. So if I have something like ileal disease, where the bile acids would normally be reabsorbed, I could actually get excess percentages and ratios of bile acids entering into the colon, where they can cause disruption of the gastrointestinal tract there, right? So those primary and secondary bile acids that would normally be metabolized differently and absorbed now kind of are metabolized in a separate way, as well as passing further down the gastrointestinal tract, where they can actually cause an osmotic diarrhea and a secretory diarrhea under certain circumstances.
Okay, I'm going to refrain from going all the way down of like the pathophysiology and how all this is working, because I have all those questions, and I think it's a really interesting condition that you bring up. And I'm going to circle back around to you saying, with this bile acid diarrhea, one of the treatments is a bile acid sequestrant. And I hope I don't sound honestly too much like a dummy asking this, but what is a bile acid sequestrant?
Hey, no, that's fine. Even a handful of years ago, I didn't know that before this became kind of a little bit more into the veterinary literature, and we're still talking like we're just tip of the iceberg here. But a bile acid sequestrant is basically medication, like cholestyramine is probably the most common one that we see, that is used to bind bile acids to prevent their functionality in the gastrointestinal tract. They were mostly developed in human medicine to help with like lipid disorders and to try to minimize fat absorption in the gastrointestinal tract. But we have this other benefit in bile acid diarrhea. It's a interesting medication, though, because it also can cause gastrointestinal side effects. So it's not something that I'm just throwing at all of my patients, right? It's something that I'm reserving for more select cases, but it's really cool from a standpoint of, once again, those cases that are failing other treatments, that we're not getting the progress we need. Then in the end, sometimes this fits. They're typically larger bowel cases again, and we can see a good clinical response with it in certain scenarios.
Interesting. And certainly cholestyramine is something that I'm familiar with. So I think you already answered this, but is there a way that we would know we're dealing with bile acid diarrhea? Like a patient we would know to start something like cholestyramine in that patient, or is it more like what you said, where we're trying all the other things, nothing is really working, and so that's when we start to think maybe bile acids are involved and reach for a sequestrant?
Yeah, for me, it's going to be my refractory inflammatory bowel disease cases that have large bowel signs.
Okay.
Right. So I suspect kind of inflammatory chronic enteropathy. It's failed diet, it's failed immunosuppressants, it's failed probiotics, all that stuff. And in that scenario, with those clinical signs being more large to mixed bowel, that's when I would try a bile acid sequestrant like cholestyramine.
Okay. Well, it's always nice to have one other treatment option in our toolbox when we're dealing with these cases.
Mm-hmm.
Well, as usual, amazing conversation. I've learned so much sitting here talking to you, so thank you so much. Are there any final thoughts, take-home messages you want us all to be aware of regarding nutritional management when it comes to diarrhea?
Yeah, I think for me in general, right, your opener, I'm going to go back to once again, because it was, I think, so perfect for this scenario, right? You have so many options at your fingertips. You have multiple companies making diets with really, really great indications for your patients. So reach out to those scientific service veterinarians, get the information, make sure you have it in your clinic, because I can guarantee you, once you dive into the details of those things and really understand what diets you have to offer, you will see massive improvements in terms of outcomes with your patients.
And then everyone is happy. Oh, pet owners are happy, pets are happy, we're happy.
Exactly.
Everyone
a diarrhea win.
Mm-hmm. Yes. Well, Dr. Rudinsky, always a pleasure. Thank you so much for joining me.
Thank you for having me.
And thank you to Blue Buffalo for partnering with us for this edition of Vet2Vet. Check out NAVC's vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.